Hi, I'm Milo Ventimiglia. One of the most important things you can do if you live with epilepsy is make sure you're keeping up with your treatment. Your medicines work only when the right amount is in your body. If you miss taking your meds, you risk having a seizure. Here are tips on how to make sure you're doing what you need to do.
So if somebody's out there and they have gotten their seizures down to, let's say, 1 a month, I mean, I know what
Which is unacceptable.
That was my message. I was
Right.
going to say, my message is that's not acceptable. That is not somewhere that you should feel comfortable.
There's no okay seizure frequency, and you know this from your own experience with your son. But there's a lot of people out there that have been told that, well, this is about the best we can hope for. Well, it may be the reality that's the best we can do, but it's not the best we can hope for. And that's been really exciting about these newer drugs that have been developed, because it does offer the possibility. So the bottom line is keep pitching, keep asking for something new, because we don't know yet what's going to be the right medicine. There's always hope. And I think with now being able to map the genome and look at the genetics, that's the next frontier, where we really can begin looking, and we already can do that in some severe epilepsies. We know some of the abnormalities that are not visible, say, on an MRI, but we can now know the genetic abnormalities, the problems at the neuron level, and we can begin targeting therapies for that. So that's why I'm really optimistic. I'm really excited about what's going to come on the next few years.
Yeah, I am too.
A lot of this is still trial and error.
Yeah.
And parents and patients have to accept that we can't do a blood test right now and say, this is the one for you. We may have to try multiple different things in different doses, but it's a process. I tell my patients, we're working on a process here. It's a long-term game.
Right.
It's not one and done. And so we're going to keep trying to put things together. We always focus on seizure counts, as well we should, on seizure frequency. But sometimes we neglect the side effects. Or we say, well, all these drugs have baggage. They all have side effects. And you asked about how drugs have kind of evolved over the last couple of decades. One of the biggest areas has been we've improved tolerability.
Absolutely.
We've got drugs now that have fewer sedating or cognitive side effects, or causing weight gain, as an example. We're now able to figure out those drugs and figure out newer medicines in testing that don't have those, or the drug interactions.
I know that, like, Jake will take a certain medication and then I gain weight. That's weird, isn't it?
That is strange.
That is really strange. I don't know how that happens, but it's one of the side effects.
Yeah.
It just happens. I blame the drugs.
Yeah, so we shouldn't be on one that causes weight loss, right?
Right, exactly.
Yeah.
Exactly.
Okay.